You cannot describe it to somebody to make sense. You have to experience it to know what the difficulties are in that place.
Don't go there, tell them to come out.
We are actually saying that we need to individualize care and look at people, find out where are they, what do they want, how can you help them achieve what they want.
When you talk of medical care, the first step is to begin to think of knowing what the problem is. Here, a man might not know that he's sick.
The problem we have in this country is because a lot of people are not educated. So when you ask people to come out for checkups like this, a lot of people are not educated, do not see the advantage in coming out for checkups.
Do you have pain all the time?
We are on a mission. We're trying to see what we can do to help people who cannot help themselves.
If we devalue one life anywhere in the world, we're devaluing life everywhere in the world.
Indianapolis is nearly 6,000 miles away from Urumi, Nigeria.
I'll be a new person in January.
But for Dr. Mercy Obemi, her home village is never far from her mind. Mercy's family practice clinic on Indianapolis's south side primarily serves less privileged, low-income patients.
Our mission mainly is to care for the people in Indianapolis who are considered the working poor.
Her patients on the other side of the world are not entirely different than here in the States.
There's some parallel between seeing a patient here who is resource limited and seeing a patient who is resource limited in Nigeria. What I have found is to be resource limited in Nigeria, a lot of the factors that eliminate that here, or that we say will eliminate it here, do not exist over there. There's no infrastructure.
The Mercy Foundation is a medical mission with the goal of providing basic health care, advice, and medicines to villagers in and around Urumi.
Then for diabetes, the same problem, The day na check up on us, na kere sugar high.
It all began after Mercy saw firsthand how difficult life and death is in her homeland.
I had gone to Nigeria in 2001. And I stopped to visit one of my professors when I found a woman who was dying in his office. Well, I went in there, saw that this woman was gasping, and it kind of really scared me because I had been told not to be too close to patients without gloves or without any protection because of the HIV/AIDS epidemic. Within a few minutes, the woman took her last breath. And I looked at her, looked at the man, and I wasn't sure what to do. I look around. The man has picked up this woman and is trying to sneak out of the building. And I figure he's doing that because he thinks we'll make him pay anyway. And there's a little kid I didn't even know was there. He was probably about 5 years old. And he's saying, Mama, I've been crying all day that I'm hungry, and you have not listened to me. You have not given me food. I'm dying of hunger. And that picture of this man carrying his dead wife and his son tugging on her clothes, knowing that he didn't have any money at all to do anything, that woman was probably dehydrated. If we just had this IV fluids, she probably would be here. And that was when I decided I needed to find out what I could do.
You might call this endeavor a family affair. Along with her children, physician husband Chris, and foundation staffer Lindsay Briggs, Mercy enlists Nigerian-born doctors, American laypersons, and anyone willing to work selflessly to volunteer for the Mercy Foundation mission.
We've already come so far in all the work that we've done, but growing and expanding and sustaining are some things that we're always thinking about. I came on board about 3 years ago as a master's student, working on my master's in public health, and my job for the foundation was to think about the things that we do and how we can sustain the foundation in the long term. And so I've worked closely with Mercy over several years to do quality control improvements to make the foundation run better and the missions run better.
Our first mission, it was just her, myself, and two of our relatives. And we went and took some drugs with us and saw patients all day long. And as time has passed, the foundation has gotten bigger, the mission trips have gotten bigger, mostly driven by the desire for Mercy to try to make a difference in that place.
Chaos is the norm. Villagers from miles around crowd into the town hall to get their spot in line to see the doctors from America. Many are returning patients, which is exactly what Mercy is striving for. Others are first-time visitors to the temporary clinic.
Yeah, there's definitely some growth abnormality that's going on with her. She needs to be sent in the pediatric hospital.
When I talked to the doctors, when I talked to my friends, they agreed with me that they need supplies. They need things to work with. And I knew that was the situation because when I talked to some of my classmates, many of them were smarter than I was in medical school. So I know that just because I had done residency here, just because I was in America, didn't change the fact that these were smart people who knew what they were doing. But if you stay in a place where you have no resources, where you can't use any of your knowledge, and where all you see is hopelessness and people coming and dying, you get to a point where the value of life starts to change. Because you've seen it so many times, you can't really be shocked like I was.
The growing network of clinics is staffed by volunteers and medical professionals throughout South Central Nigeria. Building a healthcare database for these patients is very difficult.
We started out by teaching people that they have a name and that the name was very important and that you couldn't just take a card with your name on it and give it to the next person. And then we had to talk about the fact that your age was important, not because it gave you your chieftaincy right or gave you your elder bragging rights, but your age can help me decide what to do with the information you just give me. If you tell me a particular problem, based on your age, it could mean one thing or the other. Sometimes it means nothing, but sometimes it could mean a whole lot that I need to take it serious. And over the years, we've seen that has really changed because when we went on the mission this time, we started a new site where we were just doing screenings. And it brought it back to me very vividly when, in trying to do registration, I said, ask the patients their name. We had name, age, phone number, and all that stuff. And the first few people that came through, when they got to my station, their forms were blank. There were no names on it. And I called the nurse in charge. I said, there are no names on these forms. We can't use them. And she said, oh, they do not know their names. I said, no, we have to start over. And I went back and I said, this is what you do. You ask them, what name did people call you before you got married? And then you can ask them, what is your husband's name? And let them understand why this is important. It just made it clear to me how much progress we had made because I had totally forgotten that asking patients their name was a hurdle that we had to jump through because now the people who have come repeatedly know that this is what their name is and this is what their age is. Because even with their age the first time, I would ask somebody, how old are you? They would say 30. And I would say, no, I know you are not 30. Because I'm 40 and your daughter was my classmate. So you cannot be 40. And I know you were probably at least 16, 17 years old when you had her. So you are probably at least 57.
To see the growth from, pushing through as many people as possible and solving as many small problems as we can to really thinking about in the long term, what's going to really impact people and what's really going to solve problems and be able to see that switch and to get the communities to understand what we're doing and to get them to have buy-in and really begin to see what we're doing and really support that.
Instead of being welcomed by established hospitals in the area, Mercy often encounters resistance and open hostility to her practices and ideas of health care for all people. Doctors wanting kickbacks for their services are commonplace.
One of the biggest things to deal with in Nigeria is corruption. Corruption is pervasive throughout the system. For Americans, it's really hard to deal with. In Nigeria, corruption goes from the very, very top down to the very, very bottom. One of the biggest things that we had to deal with was the chief medical director of the local hospital. He basically tried to extort money from us, and he said you can only use the hospital grounds if you pay this outrageous amount of money to use the hospital. And the hospital's funded federally and locally by the state. It's a public hospital, so there really shouldn't be any fees. We had tried to negotiate with him to come up with some kind of fair payment system for his doctors who may be helping. He really wasn't interested in a fair payment. He was really just interested in what can I get out of this.
Fearing that the Mercy Foundation's come one, come all model of patient care will affect their bottom lines, some local medical administrators resort to baseless accusations of medical malfeasance by Mercy's group.
She's making a difference in these people's lives, and she should be allowed to do so. And it's really unfortunate that the political climate is so negative, but at the end of the day, I think the people are what matters, and they want it.
This is what we need to do.
Playing politics with local leaders is as time-consuming as the actual tending to patients. But building a coalition with which to work and maintain a year-round healthcare network is top priority.
That is why I believe that we don't have to wait until we can get everything perfect the way it is here, because some of those people can't wait that long. We've been on mission trips before where we saved some people just because we were there then. The conditions in which we take care of them is nothing compared to what we have here. But somehow we've managed to do a lot of things that I never knew we would be able to do. And if you look at what the cost is, sometimes the cost of one mission and all the things we do is much less than the cost of treating one patient in this country with one of those conditions. I mean, how can we not feel wonderful about doing something like that?
Rainfall is plentiful in Nigeria. Clean drinking water, however, is not. These boys in Isan trudge hundreds of yards to fetch water from this fetid pond, the only source for cooking and drinking for hundreds of families. And yet, a new water treatment plant sits just a few miles away, unfinished and unusable.
If you go around my town, you'll discover that we still fetch water from the pond. And in the 21st century, you know what it is for a people to get water from the pond. We'll be very happy if we're able to get fresh water, potable water for our people. In short, because of that, there are a lot of associated diseases, malaria, typhoid, what have you, that is derived from using pond water rather than the potable water. So that is the greatest problem in my local government, water.
The failed promise of the government-sponsored multi-million-dollar facility is a glaring example of the waste and corruption that anchors Nigeria near the bottom of the developing world. It also illustrates the type of obstacles, whether social, political, or medical, the Mercy Foundation must overcome to help improve basic health care for the people who need it most.
If we must move forward, if we must catch up with the other part of the world, our people need serious education. We need to be assisted. We need infrastructure. We need books. You know, you talk of computers every day. There are some children here that don't even know what a computer looks like. Not to begin to think of assessing it. They don't know. Because when you talk of computers, jet age and all that, so how can a child like that be part of the computer age? So you can understand, we are backward in terms of education. Because of that, they really don't know what their right is. They really cannot say, yes, this is what the government is supposed to do for me, this is what I'm supposed to do for the government, because of the lack of education. You know, everything you do here, they look at it as a privilege, you know, which is not supposed to be. So if we are properly educated, we are properly schooled, I know that the people will begin to appreciate what it takes to run the government.
Social change and educational improvement are also on the agenda for the Mercy Foundation.
I don't care. Yeah, I want to see what is going on.
Helping to provide textbooks and computers for this Catholic Church-supported children's home is another way the foundation plans to give hope for a better life to these youngsters.
Mercy Foundation has been a blessing to us. It is true that we do share things in common because about 4 years ago when we got to know about Mercy Foundation, and when they came to us, we were very happy when they told us about their programs. And ever since then, they've been involved in the care of children also. In their education, they send books to our children. They do this not only here, but in some other countries that we are aware of. They come in here with their health programs. They organize free medical services for people here in Uromi. And our children have benefited a great deal from this program also. They've been here with doctors from the United States to check on our kids and to be sure that our kids are also healthy. Each time they come here, they always give free drugs to the people of Uromi and also to our kids. So by and large, I think the foundation is very good to us. Every year they make it a point of duty to visit with our children and to check on them.
Life here is hard. No electricity, no running water, no public transportation save for the ubiquitous motorbikes. Menial labor is the main source of income for over 150 million Nigerians. Other than oil and mineral production, there is virtually no industry. Idleness is a disease of its own. In Irua, the teaching hospital considers a working relationship with the foundation, providing manpower and resources to Mercy while adopting some of the mission's technological and procedural prowess could be mutually beneficial.
I got to know about Mercy Foundation, and we discussed the concept. They are reaching out to indigent patients. They are wanting to assist with capacity building and also assist with securing necessary funding for research, areas in which we do need lots of assistance. One had the opinion or the impression that those very good pieces of information should not be one that should be kept to oneself or to the limited audience then, but rather a much wider audience from both the college, the university, and this teaching hospital. The two bodies that have a partnership should be involved.
In the gleaming capital city of Abuja, Mercy shares her philosophy with like-minded Nigerian physicians hoping to change the business-as-usual approach to national health care.
What I'm hoping happens is that we learn from each other and we take things back to where we came from, things that we can use, things that we can illustrate, and then things that we can share.
Partnering with local hospitals and groups like the Association of Nigerian Physicians in the Americas broadens the reach of the foundation.
If you look at the health statistics from Nigeria, they're very abysmal. The infant mortality rate about 100 to 200 per 1,000 children. And if you look at the under 5 mortality rate, which even is beyond 200, those are very woeful statistics. So basically what we want to do is how can AMPA and people like Mercy Foundation contribute to reducing these horrendous health statistics.
It is not easy for government to take care of all health needs of a country like Nigeria. I think that collaborators like Mercy Foundation can come and partner with government and help, deliver health care services to the people. Most Nigerians live in rural areas, and their health needs are not met by, to a large extent by government. So it is important for organizations like Mercy Foundation to come in and partner with them.
A lot of these patients are down in some interior villages, down near the river bank, Ilushi and all that, and they can't afford to transport themselves all the way to Irua. So our going out into the community, made it easier for them to have access to this health care. And they're very positive about it. The people who are going to benefit from this outreach are the end users, are the people in the community. The doctors who participated in the outreach did so voluntarily. I participated voluntarily. I wasn't doing it under duress.
And your BP is 160/90. It's borderline.
The result has been overwhelming and has been very, very encouraging. But beyond that, we are contributing our own part in reducing mortality and morbidity, because a lot of people could easily have died from this condition if this health screening program had not taken place. Because you have a lot of patients, people who don't know that they have these conditions, and most of the cases we see are very, very critical. So I think by and large, the mission has been very, very, very successful, and I think the people are very appreciative of the effort Mercy Foundation is putting in, giving them a better health and a better life.
As in almost all developing countries, Nigeria must first overcome the corruption, instability, and lack of governmental control in all aspects of public and private life before it can truly sit at the table of the developed world. If a lone family practice doctor from Indianapolis by way of Urumi has her way, her mother country will overcome its problems through education, quality health care, and selflessness.
Many of them did not think we would stay there for as long as we have, because they've been used to people come on medical missions one time and disappear and never come back. And sometimes they didn't even know who these people were. But they know who I am and they know why we come. And they know that we promised them that we will come as long as I'm able to. And we've tried very hard to keep that promise. It hasn't been easy. It's been a lot harder than I thought it would be. But when you feel, or when people make you feel like you're the only hope they have, you will have to be dying to not answer that call. Because how often can you be the only hope that people have? How often can you be people's only source of care? And how often do you have a situation where people wait for you all year just so you can come for 1 week because they know that it makes a big difference to their life? I look at it as a gift and as a privilege, but one that is hard to carry. And sometimes I joke that this is the cross that I carry, and I'm carrying it even though I know it is hard. And luckily I'm able to get some other people who believe in what we're doing, who feel that, you know, these people are not being cared for by the government and they deserve better. And I always remind myself that we cannot let people devalue life.
Sometimes I do get frustrated, and I would say to my wife, I don't know if we're making a difference. You know? And she sticks her finger up and she goes, I know I helped one person today. I know I helped one person. You know, it's true, we help one person today, and tomorrow we help one person, and so on. But if you try to look at the big picture, you know, there are millions of people. You help 2 people. Is that help? It is help.
They've made a tremendous amount of impact. She has showed what one individual with goodwill can accomplish. Her numerous missions to her homeland, Urumi, has been a standard by which other medical missions have been measured.
First and foremost, Mercy and Chris, they are Nigerians and they're from Urumi. And I think over the years, they've been able to see that the effort they are putting into the Mercy Foundation is genuine. They don't ask these patients for anything at all, and they give them all that they have to give.
We probably just need a few more Mercies. That's all we need. Mercy has tried to write her own history, and that's what she's done.
One of the catalysts that got the foundation started was looking at myself and trying to be comfortable in what I thought was my identity at the time. I was American, I'd become a citizen, and I enjoyed looking at myself as a citizen. I was proud of it. And then I go to Nigeria and I'm hit with this shock, and I'm asking myself, okay, am I Nigerian or not? And if I'm Nigerian, then I'm a brain drain. just like everybody has said, I am again to the community in Uromi because putting into practice what I have learned in America, I can come back and try to make some changes that I hope and believe will make things better. And that people that I left behind who probably have never really let me go, they always still counted me as one of them, can see me come back and be part of this community and show them that I care and bring them some hope and let them know that, you know, we are still in this big struggle together, like I never really left.